content to cover. Today's webinar is Youth Substance Use Prevention plus Harm Reduction, and we have some really excellent panelists, Dr. Bonnie Halpern-Felsher and Alexi Orr. I'm Allison Newman at the University of Washington Addictions, Drug, and Alcohol Institute at the Center for Community Engaged Drug Epidemiology, Education, and Research. Just a few logistics. We're doing a Zoom webinar, which means that only panelists and hosts can share video and audio. Please enter your comments and questions in the chat and Q&A. Be respectful and curious. And if you work with the media, please let us know if you plan to report on this webinar and email me at allison26@uw.edu. All right, so who are we? As I said, I'm at the Center for Community Engaged Drug Epidemiology, Education, and Research. We do a mix of things, mostly focused on opioids, overdose, and methamphetamine, harm reduction, work with syringe services programs, work on increasing access to medications for opioid use disorder, as well as health for people who use drugs. You definitely want to check out our center. I will put a link in the chat at some point. Really appreciate everyone being here. As I saw the numbers tick up for this, I realized we had hit upon a pretty popular topic. We had a lot of people register for this webinar. It's a topic that I care a lot about, which is how do we help youth, stay healthy and stay alive, and how do we address this? So really appreciate our presenters here today and all of you for being here. So I'm going to do a quick poll. Maybe Allie can help me do the poll. Oh, there, I found poll. So quick poll, I'm going to launch it. First question is, what harm reduction education or supplies do you currently provide to youth? So it should be a check on all. Go ahead and enter, and then I can share, should be able to share the poll results. So go ahead and click what you're currently providing to youth around harm reduction, education, or supplies. And we have a second question too. What barriers do you experience in incorporating harm reduction education into your youth work? And are you all able to see the poll results? Yes, okay, good. Largest barrier, fear. Only resistance-based is supported in Florida. Thank you for sharing that. Oh, Bonnie says she cannot see the poll results, so I will read them when they sort of settle. Interesting.
After you end the poll, you can share the results, and then it'll share it with everyone on the screen.
Thank you, Allie. I don't do polls that much. So it looks like things are settling out. I think I'll give people just a minute to respond. I see Vanessa says, other barrier, I just moved to Washington and haven't met the right people yet. I see community pushback for harm reduction. We live really rurally. Currently in very early processes of creating policies and then determining where to go from there. All right. Other barrier, no staff, lack of bandwidth to look into information in order to teach volunteers or staff said information. All right, I'm going to end the poll. A lot of people participated, and I want to see what the results are. So it looks like the top things so that people, 22% are not currently providing anything, 59% provide naloxone, 53% overdose recognition and response education, 39% information on the Good Samaritan Law, 26% fentanyl test strips, 33% safer drug use education, and 41% fentanyl education. Barriers people experience are not knowing where to start. About half said institutional support was a barrier, half said funding limitations. A few are not interested in incorporating it. A few need technical assistance, and people put a lot of really excellent things in the chat. I also see someone saying parents are often the barrier. They want total abstinence and lack of community support. So thank you for responding to that. So why are we doing this webinar? There's a really nice paper that came out last month, the overdose crisis among US adolescents, showing that adolescent overdose deaths continue to climb due to fentanyl, while overall use continues to drop. So fewer youth are using drugs, but more youth are dying. And in this paper, they highlight that Washington State, where we are located, has the third highest rate of youth overdose deaths from 2020 to 2022. They really highlight, I think, something that's really important, that there are three groups of youth at risk for overdose: those who experiment but don't have opioid use disorder, those who have mental illness or trauma and used to cope, and those who have opioid use disorder. And the paper really says education should focus on risks, but also how to prevent and respond to overdose, and highlight safety first as an example of how to do that. And that overdose prevention should also include mental health supports and high quality accessible treatment. So this, I think, is a really important paper, really highlights the importance of incorporating harm reduction. And I have two data slides, really just showing the increase in overdose deaths among young people in Washington State. We had a doubling in deaths among people age 18 to 24, as well as 25 to 34. And it really is due to fentanyl. You know, we see this huge increase. This is people under 30 in Washington State. A huge increase in deaths involving fentanyl, and a drop off in those involving heroin or prescription opioids. So that is all the data and all the talking I'm going to do. I'm going to hand it over to Alexi Orr with Fire to talk about the program there. And yeah, go ahead, Alexi.
All right, thank you, Allison. Hello, everybody. My name is Alexi Orr, and I work for a nonprofit community-based organization in Eastern Washington, Okanogan County, called FIRE, which is the Foundation for Youth Resiliency and Engagement. Here we work primarily with young people 12 to 24, and our organization is broken up into kind of two different parts. We have a youth center called Mountain, and they serve more of the school-aged based children. And then on the Fire side, which I work on, we provide more direct services, so one-on-ones and connections with things like housing and doctor's appointments, that kind of thing. Next slide, please. At Fire, our mission and vision, we advocate for equitable opportunities that allow all youth to thrive. And we envision an Okanogan County where the opportunity for healthy minds, bodies, and homes exists for all young people. We really like to serve the populations that are most often marginalized, which would be the BIPOC, LGBTQIA+, systems involved, undocumented, homeless, and those experienced trauma. We have a lot of young parents as well. We believe that the youth voice matters. A lot of times people in our community will kind of overlook what the youth are saying, and sometimes the answers are right in front of us, and they're on the front line, otherwise know or understand. Focus on prevention, I think more on the mountain side, where they can get a snack, Wi-Fi, we have teams. It's really kind of a set up to be a safe space for those young people that might not have a safe place to go to after school. And we, really do focus on harm reduction as well. We, on the direct services side, well, actually all through Fire, we offer concrete goods like condoms, Narcan, Plan B, access to Plan C. We have a closet that is full of clothing that is free for any young people to come in and get. We also provide personal hygiene items. So in terms of, tangible items, those are kind of the ways in which we do harm reduction there. On the one-on-one direct services side, the way that I think we most often practice harm reduction, at least for me, which I primarily serve the young people who have substance use disorder, other behavioral health needs. A large portion of the young people I work with are also homeless. Something that we are lacking in Okanagan County is any kind of transitional housing or housing for people who aren't, completely abstinent of substances. In fact, most of them are not. And that applies for our older people in our community as well. Excuse me. When we look at some of the barriers that we're up against, and I was seeing a lot of the comments in the chat, is that our community can be pretty conservative and oftentimes look at harm reduction as a way of us condoning drug use, whereas we see it as saving people's lives. We believe everyone has the right to be alive, no matter whether they decide to use substances or not. Some of the challenges we have when dealing with young people and in terms of like thinking about the school-based program is that by the time we get a lot of young people, and this is including middle school aged kids, they are already exited the school system. They've dropped out. Some of them go, to an alternative school for a while. We do offer GED testing here as well. But, we have to count on other community partners to work with us in terms of like kind of casting a safety net so that we can reach all kinds of youth, not just the ones that are still in school. I would say a large portion of the kids we see, even on the mountainside, are already vaping. They're experimenting young people. Most of them are already have opioid use disorder, other substance use disorder. We see a high rate of methamphetamine and fentanyl use combined. They seem to go hand in hand with the young people I see. A lot of the young people are using with their friends and also their fashions of use within a family and a home. And what that means for our young people is that they don't have a safe adult. They don't have a place to go where they can have a trusting adult that can, teach them how to do some of the simpler things in life. And, most of them are just in survival mode, quite frankly. And so when we're kind of triaging and facing crisis situations, it feels like we're kind of throwing the Hail Marys to just try to keep them alive, which is, challenging because we do want prevention. We want to work on getting to these young people before they get to that, connect them to a detox that are available to adults are not accessible to young people. For us to get someone into a detox center is an over 3-hour drive away. Transportation is a huge barrier. We don't have a great public transportation system. I know I myself rely a lot on the local recovery navigator program because they are able to transport people. But getting someone, especially a young person, into a treatment center, they're under 18, the options are absolutely, minimal. And the time it takes to get a bed is a challenge. We know that when a young person is, or, this really applies to adults as well, but when a young person comes to me and says they want to get sober or they're ready to seek treatment or detox, we really
Alexi, could you turn off your
need to
video?
get-
You're cutting out a whole bunch. I'm sorry. I'm sorry. Can't really hear you.
them in that moment and be
Alexi, I can't really hear you
able
anymore. I
to
think other people are having the issue too.
act
All right, sorry for the audio issues. If you have questions for Alexi, we can have you chat them to her. I can't hear her at all anymore. Let's see. Alexi, are you able to hear us at all? Could you put it in the chat? So sorry to cut you off. For some reason, we can't really hear your audio very well. I will move on to Bonnie. And if we have questions for Alexi, maybe her audio will work better. Anyway, yeah, Okanagan County is where Alexi is. It has not very good internet. Really rural part of the state, but really appreciate what you shared about harm reduction and about the need to engage people across the spectrum. So I will pass it off to, we have Bonnie Halpern-Felsher at Stanford, which I assume has pretty good internet. So probably won't have any audio issues. So let Bonnie introduce herself.
Great. Hi, everyone. I'm excited to be here and talk to you. Hopefully you can hear me without any issue. Great to meet you all. I'll give myself a quick give you a quick introduction of who I am. So Bonnie Halpern-Felsher, I am a professor of pediatrics in adolescent medicine here at Stanford University. I am a developmental psychologist by training. My research and policy and education work, prevention work, focuses on adolescent and young adult health and how adolescents and young adults make healthy decisions or decisions about their health. So I in my lab, we're called the Reach Lab. I'll put to the chat in here for the Reach Lab so everybody knows. We focus on research on adolescent and young adult health-related decision-making, particularly around substance use. Why are youth using? How do we prevent? And then we translate the research into prevention and intervention programs that I'll be telling you about now. Next slide, please. So this is the Reach Lab. Reach stands for Research and Empowerment, Research and Education to Empower Adolescents and Young Adults to Choose Health. And I show you this, I promise not to bore you reading everybody's name, but I want you to see that we have a large lab involved in all the work that we do. And the lab that we have, we really are interdisciplinary. So we have researchers, we have a public health lawyer, we have several people who are educators and from the education space. We have a psychiatrist and an adolescent medicine doc who work with us, as well as many others. So really all the information and resources I'm going to bring to you today come to you from a pretty wide group of people, very interdisciplinary as well. Next slide, please. In addition, and we would all argue even more exciting, is that we have a very large, robust Youth Action Board, or YAB. We call them Action Not Advisors because our Youth Action Board, our YAB, actually works with us and they take action in everything that we do, from research to creating curriculum, to presenting curriculum, and to advocacy work. They're the ones who say, oh, Bonnie, that is so yesterday, or Dr. Bonnie, what are you talking about? That's not an issue anymore. So they really are the ones who are the backbone of the work that we do. Next slide, please. And shout out to my funders. We'll skip that. Next slide. All right, let's get into the meat of this. So we're going to talk about why is it that youth use drugs. I'm not going to give you the statistics on drug use. You saw that a little bit or a few minutes ago, and you know that's why we're all here today. I'm going to talk about why youth use And from a more theoretical decision-making perspective, then we're going to really roll up our sleeves and talk about some of the curriculums, and particularly our harm reduction safety first curriculum that you have access to. Next slide, please. So we talk about why adolescents use, again, I'm a developmental psychologist. I come from sort of classic developmental theories. When you look at the reasons, a lot of the early theories said that adolescents take risks because they cannot judge risks appropriately. They believe that they are invulnerable to harm, and that they're pressured by peers, and that they have poor decision-making skills. I'm not saying that that's the case. This is a lot of where the early thinking around adolescent decision-making came from. And because of these poor decision-making skills, per the theory, we really need to be more draconian. We really need to come down and tell teens what they should and should not be focused on. And in my research, well, let me go to the next slide. That the research also says that, and we're going to flip through these kind of quickly for the persons doing the slides, that adolescents think that they're invulnerable. Next slide. Invincible. Next slide. And infertile. That's a different talk. Next slide, please. But the truth is that when we look at adolescent decision-making and how they think about risks, there are real and perceived risks and benefits to using drugs, to any risk behavior. And the research that I've done and published over the past 25 years looking at adolescent substance use, they can make decisions. They can think about and weigh risks and benefits. They are making good decisions, and they're also not making good decisions sometimes, but it's not like they're a blank slate. So our job is to really help them understand risks, the real and perceived risks, the real and perceived benefits, so that way they are making the healthiest choices, as somebody already said, to keep them safe. And when we talk about perceived and real risks, this is important. When you say to a teenager, don't use a drug because you're going to get high, or because you might hurt yourself, or if you drink and drive, something bad may happen, and then they do use and something bad doesn't happen, we lose credibility. Instead of saying, you know what, the risks may be big or small, depending on what the behavior is, but the outcomes are really bad. The outcomes are things can be bad that we don't want to have happen to you. But also, to only focus on risks with teens is only half of the equation. There are perceived benefits and there are real benefits. Teens and adults like the high, they like the buzz, they like the feeling, they like to relax, they like the social lubrication that it brings. And for us to pretend that that isn't the case, again, when we talk to teens, this is the teen perspective, not coming from an adult perspective, but teens, if we keep talking only about risks and only about health risks, not social risks, not social benefits, nothing like that, then we lose teens. They won't listen to us. They say that you're lying, and that you don't have an honest understanding of what we do. So my point is, and thank you for the comments in the chat. My point is, and this is based on research, not just based on my thinking, but talking to teens and doing research on teens, we need to help them understand and balance the perspective and come from their perspective, not ours as an adult. Next slide, please. So that sets the stage for what we can do. How do we then talk to teens about drugs? And again, any risk behavior, a health risk behavior, a health decision-making really comes from this perspective. There was this great billboard back east that one of my colleagues who also does decision-making work, it was around sexual behavior, but it said, you can get pregnant even the first time. And teens were getting pregnant after a while. And it's like, what happened? Well, the sign said you can get pregnant even the first time. We had sex, didn't get pregnant the first time, so we must have been infertile. That's the perspective when we only, and it's kind of funny and tongue-in-cheek, but that's what happens to teens if we only talk about the small risks that might happen without that balanced perspective. Next slide. So what can we do? We need to have an honest drug education, an honest conversation with teens. We need to have it based in science, based in the real ways that adolescents and young adults make decisions. What you and I as adults put into the equation may not be the same thing that a teen puts into an equation. Yes, I might get in trouble or harmed, but being with my friends is more important. We as adults may say, oh, no, I don't care about the friends, or if they care only about me getting drunk, that they're not a friend. think about doing that when you're 14. That is not an easy perspective to have. So we need to take that perspective, honest science, the risks and benefits balance, and ultimately to keep teens safe. Next slide, please. So the goal is, and this is some new quotes that my lab, our Reach Lab came up with. One is to normalize drug education communication, not normalize drug use. When you talk about drugs to teens, you're not going to get them to use. That's not at all what we're doing. When you show them a slide with a cannabis product or an e-cigarette or anything, you're not going to get them to use. Believe me, they're already aware of these products. You are going to enhance and get them to talk about drugs and normalize a conversation, not normalize using. We want to create, quote, designated drivers. How do we think about that in terms of all drugs and all drug education? That is harm reduction. Next slide, please. All right, so our Reach Lab, I'll put this into the chat again. This is our lab, our Reach Lab website. So you can come here. We also have QR codes for those of you who have your phone handy. You can put it up to the code. This is a kind of your one-stop shop to all of our resources. And get ready, don't faint. These are all free for you. Everything our lab offers is completely free to you, with the exception of, hey, if you want to write a grant together, certainly we are not going to say no to some dollars, because that's what keeps us going. But everything I'm going to offer, if you're a school, an educator, a counselor, and so on, are completely free and easily accessible to you. So in this Reach Lab website on the left, you'll see we have our research and publications we do. Then there's the tab for prevention and intervention programs. That's your one-stop shop for all of our prevention and intervention programs, all of our news and advocacy. We have parent information and lots of resources. I don't have time to go through all of those, but I'm going to focus on our harm reduction safety first, but I want you to know that those exist. Next slide, please. All right, so in those resources, you're going to find that we have everything from primary prevention, thank you, Susan, all the way to secondary prevention to intervention and just short of cessation or cessation light. So we have curriculum specifically on tobacco and specifically e-cigarette prevention, or You and Me Together Vape Free, which is part of our very popular tobacco prevention toolkit. We have our cannabis awareness and prevention toolkit. Within that is Smart Talk. We have Safety First, which I'm going to talk about now. And then we have our Healthy Futures. That's our alternative to suspension curriculum, or curriculum for any student who is caught using, particularly nicotine and cannabis, and help move them towards not continuing or quitting, and based on stages of change, motivational interviewing, and so on. So there's a QR code there that gets you to all of our curriculums. And thank you, Scott. Scott's going to be my backup to add in a few more links as we go. Thank you, Scott. Scott's a member of the Reach Lab. Next slide, please. All right, so let's talk predominantly about safety first. And if you want to have a training, we do free trainings or additional information on our curriculums, the ones I'm not talking about today, or this one, Safety First, then please know that we do offer free 1.5 hour or so trainings on all of our curriculums. All right, Safety First. So Safety First is a comprehensive harm reduction based drug intervention curriculum. Next slide, please. So how do we in the Reach Lab define harm reduction? As you could probably imagine, first of all, harm reduction and safety first discourages young people from using drugs in the first place. But we offer more than the abstinence-only approach. We really want to provide teens, and the age for safety first is predominantly high school, but I will tell you that many schools have used safety first with middle school and even with college with success. So we want to provide teens with information to keep them and others safe if, and honestly, when they encounter substances. And this is important. It's not just keeping themselves safe, it's keeping friends safe, peers safe, parents safe when and if they are using. Next slide, please. So what does Safety First do and not do? First of all, very important, and somebody said this earlier, safety first sees abstinence or not using as the most important and primary way to keep you safe. If you want to reduce harms from drugs, not using is the best way. But we know that that's not always going to be the case. So we want to empower teens to make healthier choices using accurate information. And again, that weighs the real and perceived risks and benefits, provides true drug knowledge. It's not NO, it's KNOW, knowledge of drugs. We want to recognize that some teens will try drugs. And actually, in any group you're teaching, we know you're going to have anywhere from 10 to 30% or more, depending on your district or your school or your group, who may be using. If you tell them not to use and they've already used, you shut them off. They will not listen to you anymore. So this curriculum comes from the perspective, not encouraging, not normalizing drug use, but knowing that there may be some youth in your group who are using. We encourage teens to take steps to reduce the potential harm. So all throughout every slide set, you'll see the best way not to harm yourself is to not use at all. And if you are using, to quit or at least cut back. But if that is not feasible, let's make sure that you are safe while you're using drugs. We do not encourage or condone drug use. We don't teach teens how to use, and we also don't judge teens who are using. Next slide, please. So safety first, and it's comprehensive, as I said. It has 13 lessons, each made to be about 50 minutes, or roughly a class period. We talk about the first few lessons, and I'll show you the highlights of each lesson. The first few lessons talk about, Amanda, I don't know. I'm okay with that, but it is evident. Well, it's evidence-based light. We have some evidence. We're working on more evidence. But whether you're allowed to use, I don't know. Your particular case, happy to give you our emails at the end and have you email and we can have a conversation with you. So our curriculum starts off with several lessons that cut across all drugs. So we talk about brain and addiction. We talk about stress and coping and wellness. We talk about then all the specific drug categories, and I'll show you briefly what I mean. We talk about marketing, and throughout the whole piece, we have skill building and refusal skills. Next slide, please. All right, so the goals are to encourage you not to use in the first place, encourage them if they are to stop or quit or cut back, provides evidence-based, explore risks and benefits, and personal responsibility and knowledge, as I said. Next slide, please. All right. All of our lessons, the 50 minutes, have activities built into them, so you're not just lecturing like I'm doing to you. We have some information for teachers to learn. We have discussion guides, so at the end of every lesson, at the end of every each of the 13 lessons, we have kind of think homework, but not really homework, more like bring something home to have a conversation with an adult, your parents or caregivers, another adult or trusted mentor, or peers if you don't have an adult you can talk to continue the conversation outside of the classroom. We have fact sheets. I'll show you some of that. We have Kahoots are coming. We'll have a Kahoot any day now. At the end of every lesson, there'll be a Kahoot. And by the way, this is true for all of our curriculums, not just safety first. And our slides are made in Canva, so they're super cool and beautiful. Next slide, please. All right, so I'm going to go through each of the 13 lessons. I promise just a couple slides per lesson, so a quick run through, but I want you to see what we provide. So the first, go back one, please, sorry. So the first lesson is Introduction to Safety First. This is just an overview of asking people to think, pair, share, have a conversation about what do they think drugs are, what do they think drugs are not. It goes through some exercises to warm them up to understand the concept of drug education. Slide 2, or next slide, please, sorry. In this slide, this is where we talk a lot about actually what is safety first, what is harm reduction. I'm going to stick with this lesson just a little bit longer than the others, because I want you to see the kinds of things that we explain to them when we talk about harm reduction or keeping them safe. Next slide, please. So one of the things that we talk about, and this is both in the overview lesson 2, but also sprinkled in every one of the content or drug specific lessons. First, we talk about dose and dosage. This is important. We want teens and anybody to understand that you want to use the minimal amount that you need. And this is whether it's a prescription drug or an illicit drug or anything that you're using. So for example, next slide, please. We give an example with just Advil or ibuprofen. You could use up to 600 or 800 milligrams at any one time, but if 200 milligrams will relieve your headache or whatever, then start with that and don't jump to a higher dosage. So we try it. It's a very simple concept of just use the amount that you need to use to get the effect that you need. Next slide, please. We also talk about set and setting, again, overall and within each drug education area. This refers to your setting, your set and settings, your emotional state, where you at. If you're feeling really depressed, it's a really bad time to be using drugs. It could be more dangerous. If you're in a setting like driving, that's not a good idea, of course. So we talk about that. Next slide, please. Then we talk about drug alteration and saying that really wanting young people to be aware about drug cutting and drug alterations. Next slide, please. And with this, we do talk about, and this isn't particularly true in the fentanyl lesson, we talk a lot about drug testing and fentanyl testing throughout the lessons as well. Next slide, please. This is going to be a whirlwind. I have a really cool activity with a pitcher. You put water in, one has salt, one has sugar, and teens can't tell the difference. And that's how helping them understand what adulteration is and that you don't know what you're getting. Next slide. We talk about not mixing drugs, particularly under set and setting, but not mixing drugs that could be very, very harmful. Next slide. Then we talk about how to respond. We talk about calling 911. We talk about Good Samaritan laws. And this is important. Good Samaritan laws vary a little bit by state, some states a lot. So please do check the Good Samaritan laws in your state. We're actually going to put a new document on our website that talks about the laws across each state. But the point here is a lot of young people do not call 911 because they think that they're going to get arrested if they have illicit drugs on there. That is true in some cases, so please do check. Here in California, I've asked a police officer, he said, we just want to keep young people and all people safe. So if you call 911 and you have drugs on you, we will not arrest you. We will not bust you. We may take and confiscate the drugs, which I'm okay with that, but we're not going to arrest you. Next slide, please. Scott, can you put in, do you mind the link again to Finding Safety First? And so you can all see it. All right, how to respond to an emergency. We talk about the recovery position and we have videos on this. Next slide, please. Talk about overdose. We talk about naloxone, Narcan. That's important. Next slide. All right, that's lesson 2. Thank you, Scott. Scott put in the link. So people will say, can you give me a curriculum? It's online. You don't have to give it to you. And it's really easy to use and very easy to follow. But again, we offer free trainings if needed. All right, so that was lesson 2. Lesson 3 talks about youth and the brain, drugs and the youth brain from a very more positive perspective of, hey, your brain is really cool. You're learning a lot. That's what makes your brain so fun and interesting and important. But in that process of development through age 25, you're more likely to become addicted. And so we explain that, but we don't do it. My kids had the lesson on your brain's developing and therefore you're stupid. You can't make decisions. No, that is not where we come from. We come from the very positive, optimistic view, but also within that is the risks of addiction. Next slide, please. Lesson 4 talks about stress, coping, and wellness. We know that teens are using drugs of any type, particularly now, because they're super stressed out. So this lesson cuts across all drugs, really isn't even about drugs. It's about how do we keep you calmer, less anxious, give you better ways to deal with your stress. It's okay to have stress. Everybody does. There's good stress and bad stress. How do we make sure that you are coping with stress, finding better and safer and more appropriate ways than turning to drugs. Next slide, please. Now we get into the specific drug categories. So lesson 5 is all about stimulants. Next slide, please. Lesson 6 is all about e-cigarettes and vaping. Now I'll pause here, and same thing with our next one. If you want, this is just a 1 hour or 50-minute lesson on e-cigarettes and vaping with a harm reduction tone to it, which is great. Really comes knowing that probably 30% of the students are using some sort of vaping device. If you want a full lesson, and maybe Scott can throw that in the chat too, please, a full lesson on vaping, then you also can use, in addition, our You and Me Together vape-free curriculum. Next slide, please. Then we have the same here for cannabis. We have lesson 7, that's all about cannabis. And here too, and this is important for Washington, given legalization, same thing in California. If you want just the, if you want an entire set of lessons, curriculum just on cannabis, we have our Smart Talk. Next slide, please. And Scott's putting resources in the chat. Thank you. Lesson 8 is all about alcohol and other depressants, mostly around alcohol. We have that cool activity that a lot of people have around the red cups and around other, you know, how much is a shot, how much is a glass, how much is a bottle of beer, and so on. Next slide, please. Then lesson 9 is our prescription and other opioids. I have to change this. It's now opioid, fentanyl, and then prescription, but this is our fentanyl lesson. And actually, we're going to revise and keep adding to this because this is so, right now, so incredibly important. The message earlier, the data from Scott Hadland's paper in New England Journal, he shouts out safety first, by the way, but is just showing the data are awful around fentanyl. So we're actually building more on this. So keep coming back to our websites. Next slide, please. Almost done. On the fentanyl, I was asked to give a little more detail on what we offer. So it's just a little bit of a few extra slides within that fentanyl opioid lesson. We talk about what opioids are and synthetic opioids as well. We do talk about the potential and real harms and real and potential benefits of them. And more importantly, how to know whether the signs of an opioid overdose and to know whether what you're using is adulterated. Next slide, please. Then we talk about hallucinogens. This is lesson 10. This includes psychedelics, mushrooms, and so on. And this is another one that I love, and we are in the, really, we're always updating. So I'd say keep coming back. We're always updating and refreshing all of our curriculums and slides. Next slide, please. Then lesson 11. So we've done now doing drug-specific lessons, and now we're back to cutting across. So lesson 11 is on media literacy. And this is really that we have a cool thing in here called the CRAP test, CRAPP. And the CRAP test, way to make it up. The CRAP test is really to teach people how to know if the information you're getting is real, is accurate, is worth looking at or not. So we talk about media literacy across all drugs here. Next. Then the lesson 12 is zero tolerance. If you want to talk about drug policies in your school, suspending and so forth, lesson 12 is a good thought piece for that. Next slide. And then finally, just a summary that's there. And by the way, I didn't bring in the slides because of just trying to keep this to a minimum. It's already longer than I'm supposed to go. But our slides, all of our curriculums have a data dashboard that you could register. You're not required, but we really appreciate it for your sake to register your school, your school name, whether you're a teacher or an administrator or whatever. And then given that, you can assign a code to the students and they take a pre and a post survey. So right before the first lesson, right before or right after the last lesson, or if you don't do all 13, you could do the post test anywhere. And it really helps you understand how teens move the needle in terms of knowledge, attitudes, and intentions throughout this curriculum. And you could then get the data yourself to see how you're doing and report to your funders and schools and so on. Next slide, please. So just finishing up with a few more resources. These are all available in our Stanford Reach Lab website. Under the resources, we now have developed some fentanyl, some quit tips, some facts on cannabis, you name it, and we're building more, so keep coming back. So we have one here. If you want to just address the fentanyl crisis and you don't have time to do all 13 lessons, then we suggest you do lesson 9, the fentanyl opioid lesson 2 on harm reduction, and lesson 3 on the brain, if you could do nothing else. Next. Here's one on fast facts around fentanyl that we have as well. That's nice. These, by the way, are completely free. You could print them small, 8x10, or big, poster size. QR codes link people to our information, and they're all available. We just ask that you keep our logos on there. That's the only thing we ask. Next slide, please. We're almost done. Here's another one on how to use naloxone. Next slide. We're building a lot more of these, more on fentanyl here in general. Next slide. And then just to end, we have our own conference. Maybe somebody could put that link in the chat if they don't mind. I think I gave that to one of you. We have our 5th annual cannabis conference, but honestly, we're going to talk about cannabis, tobacco, and all drugs at this conference. It's not just my lab. We have 2 full days of, I think it's 2 keynotes and 57. Thank you for putting that in. It's in the chat, 57 workshops. If you, thank you, Mary. If you cannot attend in real time, it's virtual. If you cannot attend in real time, anybody who registers can watch it for up to a full year. And we do have CEUs and CMEs. If you want CMEs or CEUs, you do have to attend live though. But everybody tells me it's a steal for the price. We're keeping our prices low. This is the only thing we charge you for. And it kind of gives us the funds for the rest of the year. Next slide. I think I end with following us on social media. Follow us on social media. Thank you, Scott. I think Scott earlier put in the chat, if you want to be on our listserv, please let us know. But we only email out 3, 4, 5 times a year. We don't tell you every time we have a new curriculum, because you'd get an email every other day. So follow us on social media. That's where we tell you about updates, and keep in touch. And then last slide is my email, and I'll put that in the chat as well. And that is all I have for you. Thank you so much.
Thank you so much, Bonnie. Really appreciate that overview. And I saw one question, which I think you'd answered, but just to go back, could you remind us what age the curriculum is for?
Absolutely, yes. So it was made for high school, but we have middle school classes using it. And then we have had some college. I actually gave a presentation to a college group at a college conference, and they have used it as well. We are trying to work more to make it college. Honestly, the content won't change. It's more the pictures will be a little less cute. For our Smart Talk and You and Me, Together Vape Free, we have an elementary, middle, and high school, and Spanish for both of those. We don't have Spanish for this one yet, but we're working on it as fast as we can.
And then I just had some resources. The slides will be posted on stopoverdose.org and will go out to everyone who attended. We have Safety First curriculum, a link to the Washington Department of Health Overdose Education and Naloxone Distribution Program, some resources we've highlighted on stopoverdose.org, our clearinghouse, and then a few different youth-focused campaigns in Washington, though I think this went out more broadly than I expected, and I'm sure all your states also have their own campaigns. So I'm going to stop sharing and move to other questions. We have some really great questions. One for Alexi that came in during your presentation, which is, are there opportunities to access medications for opioid use disorder for the youth you serve? And if your audio is not good, you can put it in the chat. And if it is good, we'd love to hear you again.
I guess I can test out the audio. Can you hear me? We don't have medication here in our organizations, but we do connect young people to our local opioid treatment network, and there they can get on all kinds of they have all kinds of options available to them. So we just make the connections.
Great. Next question is for Bonnie, and please keep entering your questions in the chat or Q&A. The next question is from Seth. My coalition here in Washington is limited to a list of pre-approved EBPs, evidence-based programs, managed by the state funders. If requested, does the Reach Lab share their research to state agencies for their evaluative processes? Are there any other supports in place for coalitions or organizations who want to advocate for this curriculum in their service areas?
So, yes. We and Scott is here, can hop on a Zoom call, a call with anybody, or send a letter or any information. I will tell you, there is only one publication so far for Safety First. We are sprinting as fast as we can to get other publications. We know that that can be a barrier. Having said that, we do have plenty of publications on our You and Me Together Vape Free. And Smart Talk is basically the same. Take out the word tobacco, you put in the word cannabis. We are listed, You and Me is listed on many, and Scott or I can help find that, many websites kind of endorsed by California Department of Education, many other groups, if that would be helpful for you, but would be happy to help advocate for you to use these resources. I do know that that could be a barrier. I am a scientist. I get it. We're working as fast. We only just inherited Safety First less than a year ago, so it's still pretty new for us, but we're super excited about that.
And we have a question from Anne. Do you ever license out the information to partners to use with their own images?
Contact us. Sorry, if you mean images like, yes, we don't license it, you're free to do that. It's simpler. If you want to, if we have a human in a certain way or an image in a certain way, you'd rather have a different image, you can copy the Canva slides and put in your images. We have no issue with doing that. We ask that you don't do a major overhaul. The other thing we ask is that if you are, no matter what, that you make it clear that you're using the Reach Lab resources. I always say we spend or try to get millions of dollars and thousands of hours to bring this to you for free. So just put our name on it, not my name. I don't care. Put Reach Lab on there, make it clear, but you are welcome to change images.
Then we have a question from Marcy. Is the training online, live, or in person in California?
Online, live. Yes.
And are there any other questions I missed in the chat, anyone? And please enter any other questions you have in Q&A or sort of comments about whether this seems doable where you are. I'm definitely curious what people have sort of reactions. Does it seem feasible to do more harm reduction in your youth work? What do you see as barriers? What questions do you have for our presenters? Okay. Oh, good. Susan Kingston says, Alexi, how is Safety First similar to what you discuss in your program? I think that's a great question, Susan.
Wow. I think that for me, I get to see young people where they're already pretty far along in their substance use. So in my particular line of work, we do a lot of education around testing. We have test strips available, and we can give out that kind of information. But we're sort of at the back end of that, unfortunately. That's more prevention, and I wish that we had more prevention, but we're kind of already at crisis stage by the time I see young people.
Yeah, I think it's very different. I mean, I imagine that, Lexi, your group could potentially use our, maybe the harm reduction lessons for if you're already using, this is different ways to prevent the harm from using, or our Healthy Futures, which is our alternative to suspension curriculums that I can't remember if that was put in the chat or not. So those are all possible, but I agree. I mean, Alexi, you're working with a group that is struggling a lot more than just probably a simple education, prevention, intervention curriculum can do. I still think that there are things from the curriculum you could use, but I think it is still different.
And we have a question that I love from Charity. Do you have advice for people who struggle with leadership buy-in?
Can you, so I'm interpreting how the question, you mean leadership buy-in in terms of harm reduction, I imagine is what you mean, Charity. Have them listen to this talk. I'm happy to meet with people. You know, some people go, oh, Stanford professor, what do they know in terms of like, you know, liberal or whatever. But sometimes having that Stanford name helps. Being a developmental psychologist, I don't tend to say this. I'm also the incoming president of the Society for Adolescent Health and Medicine. If that's helpful, I don't tend to name pop, but I'll be president in a few weeks after I write my talk. So if that's helpful, so I'm really happy. Thank you, Jordan, or you're an idiot for agreeing to be president, given how much you're doing, how busy you are. But I'm really excited about that. But I would say, you know, I would be happy to have a conversation to help. The other thing is SAMHSA now agrees with harm reduction. Given my new role of president-elect and soon to be president, I've been having conversations with leadership at SAMHSA and at the Health and Human Services level, so pretty high level folks who believe in harm reduction. So I think maybe we can convince people.
We have some really nice comments in the chat. I think this would be a perfect way to integrate harm reduction principles into our primary prevention. Maybe some of us WA folks can be involved in pilots to grow your body of research. Someone else says.
Please help us pilot test and evaluate our curriculum. Shoot me an email. We would love to have you help us do that.
And Emily says, I'm a parent of a 13-year-old and really appreciate having access to these resources. Thank you. I have another big fan of this work, really trying to get this information out to the schools in our area. It's tough anytime you offer curriculum change. And just a whole lot of thank yous. And I know who Ann Paulson is. She works with our Washington State Healthcare Authority in communications. And she says, definitely think we can use this info as we expand Friends for Life, which is a Washington campaign about overdose education and naloxone.
So one of the other, oh, sorry.
No, go ahead.
One of the other things that we've been working on, and just to put this in your head, and if anybody's interested in partnering on this too, is how and on to that culture question in a second. It's a great question. When we look at it, you know, how do you take this harm reduction approach? We were talking about this in the waiting room before, and then move on to reality of this. So we believe in testing, we believe in naloxone. How do we get schools? Can we get schools to actually have them? In, you know, somebody mentioned condoms. How do you get schools to have this? Will they have it? So I'm working on a project where we're actually going to give schools naloxone and fentanyl test strips, and will schools take it? We're going to give free ones for a while. Will schools take it? And can we evaluate whether people are using? So if you're interested in partnering on that as well, let me know. You know, as a scientist who also does prevention, there are a lot of questions we have. Not tested it with autistic children or learning differences. Would be happy to partner to see. It's a little bit text heavy, but we would definitely do that. Culture, I'm sprinting. I know we have like 30 seconds. Culture, yes. Everything we do, we make sure that culture is built into it, especially around marketing and how marketing is to youth of color, first gen, low income, women, LGBTQ. So we do that.
So I just want to say thank you so much to the two of you for being here. I think one thing I've really taken away from this is it's really important that we incorporate harm reduction at all levels for youth, and that the reasons youth use are often pretty logical, and we need to really address and reach youth where they are instead of having, you know, our own narratives about it. So I really appreciate having you, Alexi, talk about the youth you're working with who are definitely farther down the path in use and really complicated lives. And then Bonnie, thanks so much for highlighting the importance of incorporating really realistic drug education for youth. And just letting everyone know, the slides will be posted probably, we think, tomorrow, and we'll also be sending them out to everyone who registered for the webinar. So that's all I have. I just want to say thank you so much for being here. Really appreciate everyone attending.